the leg is going to kill the patient. So the only way is to take off what's going to kill the patient, take the leg off. It's very
What makes you decide to pursue medicine at a young age?
It's nice to be able to help people. I mean, medicine is something where you do it because you're passionate about what you're doing, and so you end up doing it because you look at how you want to help people, you want to see what you can do to reduce people's ailments. And
What is this, Dr. Naresh? CVD, CAD, and PAD.
PAD means peripheral arterial disease. CAD, coronary artery disease, and CVD, cerebral vascular disease, they are all interlinked. They are all actually part of the body's arterial system.
There's this picture with a sore toe.
Person with diabetic foot is that as time goes by, a couple of things happen. Number one is that the nerve endings will die off. The second thing that happens, because of their diabetes, their immunity goes down. They become immunocompromised, which means the immunity goes down. They can't fight infection as they would normally. And the third thing that happens is their blood vessels become narrowed.
An infection from the toe right up to the thighs. What will happen to this guy? Will he amputate?
The leg is going to kill the patient. So the only way is to take off what's going to kill the patient, take the leg off. It's very difficult to accept for a lot of people, but sometimes you've got no choice but to do that.
The management of diabetic foot in Malaysia compares to other countries. I think we still have a lot of room to grow, right? Can you tell us a bit of how it works in actually, say, Australia or in the US?
They take care of your sugars. You get them to, all these patients need to exercise regularly. The blood pressure control is very good.
Dr. Naresh, you're a vascular surgeon. As a vascular surgeon, what is your role in treating a diabetic foot?
One of the major problems with diabetic foot is that the lack of blood supply. Because diabetes itself causes changes in the blood vessels, and they get narrowed blood vessels or get it blocked. So if it's blocked, so then it comes to a vascular surgeon.
The Sunway Medical Center has a sort of a system that manages diabetic foot, and you started that. Tell us a bit about that.
And patients don't actually have to come in and stay and to be inpatient. They can come in as outpatient and get the treatment all done. We've got a good foot and ankle surgeon who actually will look at foot deformity, correct it, all the various different things. Endocrinologists, pharmacists, vascular surgeons. So basically, you've got all the specialities required for a comprehensive treatment for a person in every way.
If our patients and our audience want to see you, where can they find you?
I work in Sunway Medical Center in BJ, in Bandar Sunway, and also in Sunway Velocity in Cheras.
You do diabetic foot, you do vascular, what else? Tell us.
Mainly peripheral vascular disease, which is diabetic foot and things like that. We also deal with dialysis access. Patients who need hemodialysis, they need the vascular access to do dialysis. We deal with that. We do angios of the leg. We put in balloons or sometimes stents if required and things like that.
One of the things that you do is also chemo pod, right? For
that's
cancer patients.
Patients who need chemotherapy, we put pods. And that helps because then every time the person needs chemotherapy or even blood taking, they just puncture the pod.
You still serve the government servant even you're in private. Now you still visit the government hospitals, right?
I still maintain my practicing rights with government hospitals. So when it's required of me to help out with the government side, I will help out. I'm still involved with some of the training bits with the government training side.
People out there do not know what does that mean. It means he is actually working with very little money.
It's required to serve the government. I mean, most of us would do it without any money.